U.S. is ramping up its efforts to address the growing humanitarian crisis in Gaza. David Satterfield will now serve as a U.S. special envoy for Middle East humanitarian issues. He's the former U.S. ambassador to Turkey. The State Department says he will focus on helping provide life-saving aid to vulnerable people in the region. Parts of Gaza have been reduced to rubble as Israel continues to launch airstrikes in its ongoing battle against Hamas. Israel has ordered 20 hospitals in northern Gaza to evacuate as it prepares to launch its ground offensive at any moment. Meanwhile, there are pleas for Egypt to open its border to the Palestinian territory so that civilians can flee and humanitarian aid can make its way in. For more on this, we're joined by Dr. Ahmed Al-Mandhari. He is the World Health Organization's regional director for the Eastern Mediterranean. Doctor, thanks so much for joining us. I note that the New York Times has a heartbreaking story of it's heartbreaking on one level, but it's also promising on another. Two twin girls born in a collapsing hospital in Gaza on a Saturday, just days after their mother had to leave the health center because she had to evacuate north. So there are children still being born, and yet there is no water. There is scarce food, and the situation is becoming worse. What are you hearing from your team on the ground?
Thank you very much for giving me the opportunity. In fact, based on the information we are receiving from our country office there in the occupied Palestinian territory and Gaza, the humanitarian crisis is at its maximum levels. Thousands of people have been displaced into different places. Hospitals, are asked on the northern part of Gaza to be evacuated. There are around 2,000 patients in these hospitals. Many of them are under ventilators. Many of them under ongoing, 24 hours regular care. They need to be cared for: children, women, elderlies. On the other side, there are hospitals which are on the southern part of Gaza full of patients, no ICU beds, operation theaters working day and night. Emergency departments are also full with patients at different traumas. There's shortage of medical supplies, bloods and blood products. So in addition to that, there is shortage of water, clean water for people to use. And there are many other difficulties that are making the situation there really very complicated.
And people should know, and they probably do know, that if you don't have access to clean water, then you're talking about the possibility of an even larger humanitarian crisis, a health crisis. We're hearing from multiple agencies like the WHO that there is, in fact, life-saving aid waiting to enter through the Rafah crossing. Earlier today, we saw UN fuel trucks, and you talk about water. You need the fuel to run these plants that will purify the water or take the desalinization plants.
And to make baby formula.
And to make baby, all this stuff. But I thought to myself, even if they do allow for aid to come in, it's not like it's a light switch. This is already an area that was suffering before this happened. Can you talk about what you know about why aid is being held up? And even if aid gets in, it doesn't mean that the humanitarian crisis is averted.
I fully agree with you, and thank you very much for bringing this sort of narrative. In fact, the situation there, as I said, is very bad, and even if we are allowed to take, these humanitarian aids inside the area, it will not be switched off to the other side. Things will be fine. The demand is really beyond what is available at the cross border. But however, we are hoping that now, sooner than later, to have the corridor is open so that we can provide these supplies. As a WHO, we managed to get our airplane shipments, into Al Arish airport, waiting to be allowed to go inside. As well as we have, teams with different technical competencies waiting to go inside. We have our logistic hub in Dubai also having, tons of supplies. So the situation there is really bad, and we are waiting that hope to open it and allow us to go for food, for medical supplies, for water, for fuel, for, also evacuating badly injured patients from that area to other countries for further management.
Doctor, Israeli Prime Minister Benjamin Netanyahu says that Israel has restored water to southern Gaza. But as Anne-Marie points out, in the time frame that this siege began, if people, for example, were consuming contaminated water because they didn't have any water, you're talking about a cascading series of events, even if clean water and food are finally making its way to people who need it.
So when what about the people who run these plants? Are they evacuating? I mean, you need people to stay
exactly
to help.
There's an infrastructure that needs to, a skeletal infrastructure, but an infrastructure nonetheless that needs to remain. And also, Doctor, so as people start to congregate in southern Gaza, we're talking about a refugee situation. The World Health Organization is very familiar with what happens when mass numbers of people are congregated in a certain area without clean irrigation. What are some of the cascading potential calamities that await folks down the line that the World Health Organization is prepared to help with?
I mean, that is our real threat, when it comes into public health. As you said, availability of clean water is a must. Currently, there are people who are using, unclean water with the possibility of having waterborne diseases, like, for example, cholera. Even if we allow clean water to go through the system, I think many of the plants there are destroyed. Most of the infrastructure is affected, and many of the people who are running these sort of systems are away from the plants. So it will definitely take us hours to resume back, the availability of clean water. And as far as I know, based on the information we received, until now, there is no, sort of system pumping clean water to that area.
Well, let's pray that the aid that you are providing gets in there sooner than later. Dr. Ahmed Al-Mandhari, thank you very much.
Thank you very much.